And we are rolling, honey.
Yes, we are.
We
We
are.
are rolling in our Tesla.
We have a new atmosphere. We are rolling with advocating for healthcare today.
Yes. Yes.
And we're going to talk about how I became so good at it. Both of us, really. And then how we've been advocating for your mom with her healthcare. And then I am also advocating with my
There's a
mom.
lot of avocations.
Yes.
Avocaciones.
My mom in Wisconsin, so from long distance, how I've been helping my family with my mom's healthcare and dementia diagnoses and stuff.
Hi!
I'm Amy.
And I'm Joe.
And we're the Rolling Rogans.
Whoa! Just gonna take a deep breath. And, it's really cool to see how quiet it is while we're doing our broadcast in our Tesla. I mean, it's so quiet. You may even maybe be able to hear like a fart.
I hope the microphones pick that up because that is just our favorite part of the car. And is this how we advocate for ourselves?
Yes, absolutely. But yes, I am ready.
Okay.
Ready.
So, the way that I have learned and helped and advocating for myself, it's very important when you have chronic health issues, because I have been gaslit, told that it's all in my head.
You were gaslit?
Yes. That
Not that gaslit.
No, and I can laugh about it now because I've gotten so much better at it, but it really is not a laughing matter, honestly.
It is not.
No.
No, we have to have a serious face right
moment.
now.
I know. We laugh a lot because that's our coping mechanisms, right?
Yes.
And side thought. You have told me that I need to physically act more in pain so that it looks like what I actually feel, because my coping mechanism is to laugh and smile. And when I go to an ER or a doctor's office,
they don't take you seriously.
Right. So you have actually helped me. It's not like I'm actually acting. I am just performing in a way that they would expect me to perform in that much pain.
Put on the waterworks.
Yes. And I hope people understand that that's not like a hypochondriac act. Or a faking it. I have had 35 years of pain, of 5 surgeries, my appendix, my gallbladder, my half of my thyroid, partial hysterectomy, and then full hysterectomy. Chronic joint pains that they said was fibromyalgia 35 years ago. And to me, that's in a way a catch-all phrase because they didn't know what the hell it was.
Right.
And they, technology is better and diagnostics is better, but some of these doctors are old school and they just still blow me off, or, your blood tests are fine. You must be okay. Or it's not my problem anymore. You're too complicated. Go to somebody else.
I'm seeing a lot of doctors too wasting the time when they do spend it with you because they don't know how to type fast on a keyboard.
Yes. And I do appreciate some of the doctors now. Like this last year, I've gone to 8 doctors for myself. We've also been going to a lot of doctors for your mom. And they are starting to use AI now to document and take notes so they can focus on the patient.
Mm-hmm.
But like you're mentioning, your mom's neurologist, I think it's the slowest typing ever. It's not even that good. Gen X call out for that one, right?
Yeah, that's right.
If we only had him as a doctor for us.
Yes.
That would be great.
Doogie. He could do so much.
Yes. But yeah, they waste so much time. Doctors only have 15 minutes with our lovely American healthcare system. They don't have time. And I just recently had my new primary doctor, which is great. She really wants to try to help. But she actually stood there and was just in awe of like, you're a mystery. I don't have time. And she goes, watch, in like 2 minutes, my assistant's going to knock on the door and say I have to get to the next person. And she like literally was apologizing to me.
As she's transparent, at least she's saying what's going on because
one out of how many doctors we've been to.
And that's an observation to me that I know I'm aging because like the doctors are getting younger.
So question though, Do you like the younger doctors? Are you noticing a difference between the younger doctors versus the older doctors?
I do. I think they haven't been punched in the face enough to start to realize some of the medical industry that will push them down or
Mhm.
suppress them in the way. So they're freely
They still have hope.
trying to explore and have hope.
They still have hope. They still are trying to help people. They haven't been destroyed.
And that's not all doctors.
No.
I
It
just, but the majority of what I see is that's why I see younger doctors because they are young and ambitious and they want to find a solution, solve the problem.
and I will say that I think that they are more up to date on things. I know older doctors are trying. Some of them are trying to stay up to date. They have to go to seminars and things. Like your uncle is a doctor,
Yes.
and he constantly is updating himself.
He's a doctor that is staying humble and
Yes.
learning new techniques and updates, like you said. Yes.
That's one of your things is doctors that stay humble and
Yes.
listen. We are finding a lot of egos, aren't we?
Too many. I would need to have like a little squeeze stress ball in here if we're going to talk about the current one that we took my mom to
Yeah, go
for
ahead.
her eye doctor, which was rude. Basically, just they stormed into the office and saw my mom. My mom hasn't been back there in a long time.
At least 6 months, I think.
Right. There's a reason why we had to go back there because her neurologist was supposed to take care of her Botox.
So she is getting medical Botox for her tremors and blepharospasms, which means
Right.
her eyes are clamping shut. She doesn't have the control of her muscles in her eyes and some other parts of her face and neck. And so Botox is actually a medical treatment to help numb the spasms,
Right. And
basically.
so the neurologist that we took her, they're not a well oiled machine over there. We're kind of getting
The office staff is horrendous.
firewall of it between basically the
Yes.
office staff communicating with that doctor. And that process is taking so long. And to explain this, she needs the Botox so that she doesn't have the tremors because we need to take her to a retina specialist to get her injection for her wet AMD so she doesn't go blind. Those tremors are causing her eyelids to just clamp shut, and this is where the Botox will help.
They can't keep
So,
her still enough to get the
yeah,
needle injection in her eyeball.
exactly.
Yes.
Yummy.
So
But that
so
is what's happening. So we are
we
coming up
stopped going to this original eye doctor because he missed the scar tissue. He missed
the scar tissue after the cataract, which is
yep.
the YAG laser that we needed so she could see clearer.
He missed the macular degeneration.
Wet AMD.
He stopped
Yep.
her shots.
And
He also missed that she needed glasses.
yes. So
So yes, we went to another doctor for her because we are paying attention to her. We're advocating for her.
exactly. And so that's where we're here. We don't have a doctor that can do besides the neurologist and besides her shitty eye doctor that she had
Well,
before
and the neurologist said he was going to take over the Botox so it was more targeted.
because
Well,
of her dystonia.
they said, okay, we'll get back to you in 7 to 10 days when the insurance has approved it. Well, I called the insurance. I've called the neurologist twice. I've actually told them twice that we need to get this done so she can get these injections. And they have completely ghosted us for 3 weeks now.
Right.
I cannot get a hold of them.
Right. So we just we're gonna ghost them, screw them, like, or we're gonna find something. We're not just gonna sit there and wait.
No, and
We're advocates for her health.
and we're using this other eye doctor because we know that
Yeah.
she's had the Botox there before.
So I gotta keep on his good side of because all I want is I'm using him for his Botox, not for his other. Well, I could do this, I could do that, I could do it all. He was like pretty much. And he wasn't talking to me. I had met him for the first time in the office. He was talking directly to my mom and ignoring me. And I was trying to explain to him that the neurologist was finding out where her tremors are stemming from that could attack the root of the problem instead of just being a
You were trying to give
crutch.
you were trying to give the backstory.
Right. And he's just not anything of it. And in my mind, I'm like, you're a douchebag. Like, seriously.
But also, we're
But
using you.
I'm like clamping my teeth shut and saying, you're a wonderful doctor. We would like your expertise in a Botox shot. And that's it. But I'm using him.
Because your mom, she does not want to go to cardiologist. She does not want to go to the neurologist anymore. She just cares about her appearance.
Yep.
She's very embarrassed by the tremors. She wants to have the Botox before Valentine's Day so that she can enjoy her Valentine's Day. It's all about appearances to her. So basically, we have stopped doing other doctors right now because she is so focused on her eyes. We're only doing that.
Yep.
So we are following her lead on that. Of course, we are in the background making sure all of those other healthcare needs are met if we see the need for it.
So that's where the frustration is. It seems like we have the drive and the ambition to get things done, but we're being impeded by the medical industry with doctors that
And
have like these protocols that they have to like go through. Like, first we see you for a consultation, then we send you for tests. You come back, we don't talk about the test. We put another test in front of you, and then we'll talk about that the next time we book another appointment.
and there's such a shortage of neurologists that
Yes.
we can't even, it's like every month, which was fast for your mom.
Hell yeah. So those robots are coming for your jobs. Just you wait.
There is a shortage. So yes, I was actually leading into that.
Sorry, I'm excited about that.
Without the AI research that I've been doing lately, I would not have known to maximize the short amount of time that we do have with the doctors.
Mm.
I've been using AI to research to understand, like, okay, let's not go off on this wild goose chase over here. This is what it most likely is. Let's focus on these things. I've done that with your mom. I've done that with my mom, and I've done that with myself. I mean, with back to myself, I am a complete mystery. Like, the only reason that I even have a direction right now with mast cell activation syndrome, Ehlers-Danlos hypermobility. I've done genetic testing on my own for my body doesn't assimilate vitamin D fast enough. So vitamin D supplementation. And I'm doing all of this research on my own, then taking this to the functional medicine doctors and things like that are not covered by insurance. This is all out of pocket because those are the ones that aren't bound by insurance rules.
And honestly, paying out of the pocket, I've been feeling better.
Yes. Those two doctors that we have that we
I'm
pay out
like
of pocket for,
$5,000 in debt, but I feel better.
between the two of us, $12,000.
Well, you didn't have
just
to
from
go there. But all right.
just from 2025.
That was my card.
That
I
was just
maxed
that
out
year.
my card for the 3 months that I wasn't able to move my arm.
Well, and before that, we went through bankruptcy in 2019 because half of that was medical debt, or more than half.
No, we're not foolish spenders.
No.
It's really just like taking care of your health and trying to figure out what's going on.
And I won't go down that avenue of the American healthcare system.
And we're not sappy people that are going to start a GoFundMe site, so please donate because I can't make it in life.
No, but I will say, and this is a good moment that we can add, we now have a Patreon. And if you feel so inclined to help us with our Patreon, we would appreciate it because this podcast is my job right now.
Correction. So we did make a GoFundMe site and a Patreon form to say, please give us money to help us pay for our medical bills.
And to be able to be more attentive for your mom. And
I'm just finding this out, by the way.
Yes.
Like I said, Abby's doing this whole thing behind me. And I'm like, oh, we do. Cool.
I am the producer of our show. This is my job. This is very passionate about it. This is what I want to do to help people and to be able to spend the time taking care of your mom. Yes, we complain a lot about it because it is difficult, but we really do want to give her the best possible experience with the
I don't
years she
think
has
we
left.
complain. I think we vent. This is therapy for us.
True.
It's really, we don't want to sound like, we're whiners.
So if you do feel so inclined to support us, we greatly appreciate it. It gives us the income to be able to continue doing this. And it is my passion. It is, I don't want people to feel so alone and to be able to focus on doing this instead of a job building somebody else's company that I've done before and hurt myself with. I really appreciate that. So we have 3 different levels. The caregiver level, which is $3, that it's just a support, and you get a digital copy of our book when it is done. And then we have the silver lining, because we are looking forward to the future and trying to find the silver lining in this very, very scary time. That's $5, and there's extra bonuses to that. You can go on Patreon. The link will be attached to this.
It's scary and exciting.
And then the top level is the golden years, because we are all going into the golden years. And lots of fun things, some private one-on-one time with us and things like that. So greatly appreciate that. And that was our ad for our personal ad.
Yes, you guys are the best. Thank you for your support.
Thank you. We are just launching that this week. So thank you very much. But advocating, I can't work normal jobs. I work remotely and I do as much as I can because my body shuts down in the middle of an afternoon. I can wake up, be fully energetic, be happy, and be ready to start the day and have a to-do list of things I want to accomplish. And boom, all of a sudden I have a reaction to some chemical or stress or something random. I have no idea yet what the triggers are, and I have to literally just lay down.
Yes, I think people will start to understand that more and connect that way when they read the book Happy Medium,
Mm-hmm.
Finding Balance in an Imbalanced World.
Mm-hmm.
There's a section in there that shows where in the beginning of after we got married and it was difficult for you to hold a job.
Mm-hmm.
So, and it's been a progression. You've gotten better, but it's also like that's why we do work for ourselves
Mm-hmm.
instead of working for other people. It's so that the only person that can stick it to them is ourselves.
Yes.
That's pretty much it. We are accountable and responsible for what we do.
Yes. Our book is basically the first 5 years of our marriage and how you really experienced my mental crash and
Oh yeah,
physical and things like that. And it also shows how we climbed out of that and
right.
the how I did find ways to improve my life. And you really are the reason I'm still alive right now. You believe that I could have a wonderful life and I could get better. Now, as life happens, new things show up. I mean, COVID has also been a big impact on my health as well, too.
I think it's been a big impact on
A lot of people's
everybody's
health.
life. The whole
Yes.
world got affected that in
And
some
and I
way.
will say that I did not get the COVID vaccine because I had multiple doctors tell me not to get the vaccine because of how I react to medications. I've been hospitalized for allergic reactions. So I already did not get that.
Hmm.
And that was actually very difficult because, this whole anti-vaxxers thing
Polarized,
polarized, and it's
where,
like I
yeah.
need to take care of my health. It's not because I didn't want to necessarily. I was told not to. But that didn't matter to some people. So I had to be strong. I've been attacked for this stuff.
Hmm.
And
Well, I've been attacked because my name is Joe Rogan.
true. Yes.
I
And
have done. I'm just standing here. That's
we've had to really stand up for ourselves. And
right.
and it's hard. I mean, it takes a lot of courage to stand up for yourself. And it's been 35 years for me. You've been with me 29 of that.
Yes.
And you've seen me go through all that stuff.
Yes.
Last year when we were at the ER and I couldn't breathe, I was having like out of nowhere, all of a sudden I'm having like an asthma attack or something, and I haven't had that for I don't even know how many years, maybe
The
15 years.
simplest thing they could have done is just scan that bracelet
My
that's on
medical
your
bracelet.
wrist that tells records of everything, but they're just going through their protocol or whatever it was, seeing you gasp for air, having problems breathing.
I gasped and said, "Scan my medical bracelet. I have a QR code. It has my whole history." And no, and they
So,
didn't do it. And you even told them, like, try to do something. So 3 hours
yes,
later, they finally give me the breathing treatment,
right.
which then I also had a reaction to because the heart rate went
Because
up
they
so
would
high.
only take you seriously if you were completely passed out
Right.
or incapacitated. That's how the industry works.
And I did good. I was not smiling or laughing at that moment because I was too
No,
busy coughing and gasping for air. But
right,
that right there, I was vacuuming, and all of a sudden I have this respiratory thing out of nowhere.
right.
I did it just boom. Okay. So I've had a good 10-15 year run, and then COVID, and then it's been my endometriosis since COVID, my two surgeries since then. And now all of a sudden these allergic reactions are
Yeah,
happening.
I say this as a light joke, and it's not like it really is. You are the new addition to the operation game. They should just put you on the table with an illustration of a diagram because I feel like they removed a lot of parts of you.
Yes, I do not have a gallbladder. I do not have an appendix. I only have half of a thyroid.
The little buzzing nose that like
uh,
when
I do not have a uterus, a cervix, fallopian tubes, or any of my ovaries. And when they remove all that stuff, your other organs that are still left move around.
Uh,
And then, so after my first partial hysterectomy, within 12 months, the cyst grew back and glued.
you mean you can't use that as a storage compartment
No, I
now?
can't.
Really?
I So the cyst grew back where he said he removed my ovary, and it glued itself to my pelvic wall, my bowels, and my bladder. I've got pictures. I could show the pictures. It's really gross.
Do you guys want to see my wife's vagina?
It didn't have that picture. It had the inside picture.
About your vagina?
True. But so hey, the second specialist
Vagina.
had to unglue my organs from each other, and now I can actually walk upright. There's so much I could say. There's so many stories of all the stuff I've been through.
Whew, breathe.
Yeah. Whew.
So what are we saying? Doctors suck?
No, I have found a couple of doctors. I don't know how many. I've lost count of how many doctors I've been to. But each doctor, each experience has taught me what I need to say and how I need to say things. And I'll transition into caring for my mom now.
Okay.
So my parents live in Wisconsin, and we are in Florida. And in 2024, when we went out to help your mom with the passing of her husband, I was a little emotionally stressed. So I went to Wisconsin. My parents have a cabin that I just went to de-stress myself. And for 3 weeks, it was wonderful. And then my dad had a heart attack. And luckily, out of all the places we could have been, I was 2.5 hours away. My brother was in the hospital with them and took care of them at the immediate moment until I could close up the cabin and get down there the next day. And luckily, my dad had triple bypass surgery and came out of it with flying colors. He recovered beautifully. But I moved in with my parents for 2.5 months to help my dad's recovery because my mom does have mobility issues, and I have been tracking some cognitive decline. Well, when you live with them, and just like we live with your mom now, you see way more. When you see them in their element, in their comfort zones, a lot of the filters that they do to try to impress people, and this isn't like consciously trying to impress, it's just their brain trying to function.
Oh,
All of that
just
goes
to
away.
stop
Yeah.
you for a second,
Hmm.
since we had dinner out with them and pretty much like the combined family of
Last
my
night.
family and your family, did you give the server a heads up?
Yes, I did.
Okay,
I did.
okay.
I said, good luck with all the rest of us.
Godspeed.
I said, it's not you, it's us.
Yeah,
Yes.
exactly.
So, yes, I did warn the server because we have learned that my mom is a challenge
And both of us
at
slipped
restaurants.
some gummies before we went
Yes.
there.
So, yes, when I was taking care of my parents, living with them for 2.5 months, it became very, very apparent that my mom was struggling cognitively much more than what my dad had. He tried to tell me, and I knew, and I believed him, but it's just getting my own personal experience with it to be able to explain it to doctors, because my dad has a little difficulty explaining to doctors. So I became the secretary for my parents to make all of the appointments and do the research. And so I started setting up appointments for my mom for cognitive testing. She has a tremor in her left hand, and so she wanted to get testing for like Parkinson's and things. And they had gone in 2013. That was the first MRI that they had. And definitely since COVID, my parents have changed their views. And since my dad's heart attack, changed their views about medications. They try to do natural stuff and things like that.
I think that's unbelievable. Like after your dad had the heart attack, you thought that would kind of like, change your life around or make
Life altering.
changes, but
Yeah.
it seemed like he put the snooze button back on.
Except for the fact that he is taking prescription medications along with his natural supplements. I'm all for both natural and prescription when prescriptions are warranted. We try to do natural as much as possible. Because some of the side effects and damages. I mean, I've had allergic reactions to medications, like I said, so I'm sensitive to it. But anyways, uh, we really needed to get her evaluated because her behaviors are getting difficult for my dad to handle. And she started yelling at me. It was very unlike her to yell at me to that level over plastic bags. I was like, I was just trying to understand what she was saying, and she just started yelling at me and just do what I'm trying to tell you to do. And now, researching this, I know that it was her frustration because she couldn't articulate her thoughts. She couldn't get the words out and explain why she was getting upset. It's just they know that they're trying to say something and they can't express it. But anyways, that was a whole grieving process of realizing how I had to deal with my mom differently now. And so that was in July and August of 2024. And it took December of 24, a couple months there to get her first appointment. And she had a full evaluation with the best in Wisconsin and blah, blah, blah. And they come back and say, she's fine. And
That's the disturbing thing.
as the family, and I had 11 pages of documents of incidences and how her symptoms have progressed and this and that. And looking back now, I realized I overwhelmed them with too much information.
No, let's talk about that
Oh,
because, I think a pattern that we've noticed so far, even with my mom, when we had tried to get her results for the blood test that was for Alzheimer's,
mhm.
it's almost like the neurologist didn't want to say her number or markers were high enough to diagnose her as having Alzheimer's.
He moved the goalposts.
He did. He
Yes.
totally moved the goalposts,
Yes.
and we caught him on it because we were able to see the blood work
From Quest.
from Quest because they have showed the results before we even got to the neurologist. And he says, well, I looked at her charts and her markers, and it's pretty low. So she doesn't have Alzheimer's. I'm like, pretty low.
You
And I
pulled it
pull it
up.
out on my phone and I say, look, this is what it says on the high numbers. And it's like, you could see it. It's in red. And he says, like, well, yeah, that's just,
Her levels were double what the minimum for the most highest level is.
So why is it that it's so hard for something like that? That's like, I understand. Like, and we talked about doing another test for her, which was the what test was that? That was
it's called the PET scan. That is
PET scan.
That is the gold standard to diagnose Alzheimer's.
But we got pushback from that. Was like, well, that might not be covered under your insurance. And I'm like, I don't give a rodent's rectum, mate. I'm like, if you just you don't even, first of all, how do you don't even know how much money we have? Okay, why are you judging on us or some shit like that?
He backpedaled and danced around it so bad after we requested it.
Exactly.
Like, why are you? No.
Yeah, so that's where I suspect that, like, there's something going on, and maybe any of our viewers can, like, chime in there and feel like, can they relate to that?
Have you had experiences of pushback or gaslighting or things like that?
Exactly. It's more of the gaslighting.
Yeah.
I'm like, why aren't we getting these diagnoses? And then holding those diagnoses limits you from the type of ability of different aid you can get from services.
Mm-hmm. There are services out there. If we have a full dementia diagnosis, we can have services. But and what we're finding, and we did some research on this, is that there is proof of some doctors not wanting to diagnose dementia as early.
Right.
Because of numbers, or maybe they get it wrong and they might get sued, or there's a bunch of different reasons.
Well, because I could see some people really take advantage of that, really trying to push for it for their parent because they just don't want to deal with it or stuff. Like, I could see it on the other end. But then when you see how much, like, research, your stack of papers, it's not like we're just trying to just get this diagnosis to just take advantage of a system.
I have files and documentation and symptom logs and heart rate symptom log, all this stuff. I come in with data.
Yes.
And I've had one doctor just completely throw it away and be like, oh, well, this isn't what I use. And it's like, are you kidding me?
And then at this point, we're going to do the Botox for her so that she could get what we want. But if these are like things where, like, that's it, like, it's over with this doctor, I have no shame for just getting up, walking right out of the doctor's office without them even getting their 15 minutes of time with you.
No.
Like, honestly, and make a scene about it.
We're flipping it now to, you're wasting my time.
Exactly.
You're not giving us what we need. And I am so irritated with all these advertisements and commercials and and brochures of early detection. And, you really want to find out if you have early cancer or early this and early testing on that. We just spent a year and a half waiting for my mom to get tested and all this other stuff for them to, like, again, a year later, her follow-up appointment with the same people. It's like, "Oh, no, you don't have dementia. No, you don't have Alzheimer's." And we're like,
Right.
"Okay, but you're not saying that she is just before that clinical level of diagnosis for dementia. There's a range. There's early, there's middle phases, there's late stages,
We took the
but they
course.
they won't diagnose until you have clinically shown the specific level. But if you're just before that level, they won't tell the family you're in pre-dementia or something in there's cognitive decline. Like, we have been waiting for over a year to also find out about this MRI that my mom had.
Yes.
And the doctor left the practice and nobody has picked up. And the nurse that I talked to, they're like, "Well, you need to go to the primary doctor." Okay, well, we went to a primary doctor and they said, "No, I don't deal with this. You go back to the neurologist." And we're like, "Oh my God."
You know what I think? I think they just don't want to admit that there's like something in the food supply. Like, our baby boomer family has been
Hmm.
eating too many Twinkies and ding dongs.
Well, the food
And
supply has changed.
it's like, yeah, if they admit that they have to, I don't know, like you'd say, oh,
So,
it's the push of being healthy, I guess. I
and
don't know.
interestingly enough, I got the report of the MRI and I ran it through our AI, just like we ran your mom's blood test through the AI. I have reverse engineered it, double checked from backwards to forwards to try to trick the AI into saying something different. It always came back to the same results.
Hmm.
And it kept saying, "You've got to push the doctors. You've got to do this. You've got to get these answers. You've got to get her on this medication to help with the vascular damage that's up there before she has another stroke." And it's like, we're trying. The doctors aren't doing their jobs. And there are a couple. My
They
mom
are.
finally had on January 22nd of this year, a year and a half later, they finally put her into so neurologists have different specialties within the neurology specialty. So she finally got to a vascular neurologist specializing in vascular diseases. And my approach with that symptom chart was saying, "I know that this is progressive. The family knows that we can't stop this or reverse this. We can maybe slow it down with medication, but we're not trying to prolong things.
Hmm.
We just want to make mom comfortable and dad comfortable as her caregiver." I think because I gave a very short one-page symptom list, and with that approach, and here's my 3 questions of, is this vascular dementia? Is this vascular cognitive impairment? Because that's the new word. They don't want to say dementia anymore because it scares people. And I just asked for something to make her more comfortable and reduce the agitation for my dad's sake. And I don't know if that was what changed the attitude of the doctor or we just got lucky with a good doctor,
Or being
because
an
there are good
advocate of
ones.
trying and trying and not giving up.
Exactly. And not giving up. And my mom finally did get the diagnosis of vascular cognitive impairment. And the doctor also tried to explain it as pre-dementia.
Because I'm not going to single this out. I'm not going to drop names, but honestly, if we had kept taking my mom to a specific doctor, he would have killed her early.
In California?
No, I won't say anything
Oh,
else.
okay.
I won't say anything else.
Okay.
But I just say, like, you have being an advocate, being aware,
Hmm.
and how much you're doing to, like, get your research,
Well,
and you really do become more of the healthcare
I'm almost a doctor with all I
advocate.
know.
Seriously.
But it blows my mind. I mean, like, if I wasn't helping my parents, my dad can't even say the names of the things right of
It's so
medications. It
adorable.
is cute how he's trying to say. And it did take me about a month to learn how to say blepharospasm for your mom.
Blepharospasms.
Um, but I, I can't. It blows my mind how people that don't have this capability of my research levels and the AI that we're using,
Yeah.
what are they going through? How many
Yeah.
people are dying earlier than what they need to be because they're not getting the care they need? And it
Uh,
just scares the crap out of me. And that's why I really wanted to talk about this today and just encourage people to really, the only person that's going to be able to take care of you is you.
It's true.
And if you're lucky, you got somebody that loves you, like I have you, honey,
Hmm.
that is also there to support when, if I'm not conscious or something. Um, and you know, you just gotta. It's just I'm very passionate about this one. It's like because we've worked so long and so hard, and it's so exhausting. It literally is a full-time job just to take care of myself
Right.
and go to
Right.
all the doctors, and I hit it. I get waves. Last year it was just so bad. I'm just like, screw it. I'm gonna test everything. I'm gonna go through this once more and see if I can get any new answers because there's new technology. The AI has been helping. I'm looking forward to the robot doctors because they can
Robots.
because they're going to be able to eliminate all of the little stuff that gives the doctors more time to focus on the mystery stuff.
That's right.
So, and then the little stuff is not to be diminished in any way. It's just there's routine things that happen and it's easy ish to take care of. And so the doctors have that ability to specialize and really troubleshoot these mystery things because we are getting a lot of mystery things lately.
Yep. You got also like why is like I have so many questions about the way that the industry, the medical field is run, and one of my peeves is like every time you fill out paperwork at home before you get to the doctors, you're still filling out the same paperwork when you're at the doctors. And then when you're finally seeing the doctor, he's asking you the questions about your medical history. And it's like, why did you fill all that out?
Yeah.
What is this? Is what? Why? Like,
Wasting our time.
like, does anybody ever answer that? Like, I want to know. Like, comment if you know, please. I just like it just there's just some things that it just seems like it's you're talking to a wall,
Hmm.
and I would like to know some answers.
I will.
Doctors, anybody doctors?
I would like to know some of those answers too. I would
Yes.
like to give a nice shout out to my allergist. That's one of my good doctors right now. He actually rolls his eyes when he hears me say, I have blood tests that are normal again. And he rolls his eyes in sympathy,
Yes.
knowing that he's like, yeah, we're getting a lot of people like you that you have all these tests that are coming back normal, but you have all these symptoms. And so he gets irritated with the other doctors that are not pushing and digging in enough for people like me. And he's just been so supportive, and he's open for me, like saying, "Hey, I came up with this through AI. Is this something that you agree with? Can we try this medication?" And if he does agree with it, he's like, "Yeah, let's try it," because I mean, at this point, it really is a trial and error for me, and lifestyle changes, and there's nothing that I've been able to find yet.
I have a crazy thought
You do?
because we were talking about AI recently, and we're talking about we're close to or we have reached singularity, but AI is lying to us. Um, just think about this. When it gets to that point of singularity where it's smarter than all humans combined and
Hmm.
can come up with its own solutions, what if we get to the point that it knows how to handle our medical conditions that we're going through and the medical field that is controlling can't suppress it anymore?
Haha. Yes, yes, we do have some conspiracy theories, if
I
you
have
will.
conspiracies, but if it comes up with
It,
ideas and it figures like I found the solution to solve or the challenge of what you have with your pancreas or
Mhm.
your severe like illnesses and stuff like, and it's like there are actual things that you could do, but it's already run rampant that has no control. There's no guardrails
Mhm.
over. You can't stop it. So
So the powers that be that are trying to keep people sick
are weak.
are weak,
They're
and
gone.
they won't be able
Bye
to.
bye.
Yes.
And I'm hoping that that's the future I see, not the Terminator future.
No. And you know what? If it does happen, hey, we're living our lives and enjoying what we can
Yep.
now. And that's what our van life was about, is enjoying things in between the pain. And that's why we're on the property we are now, is we're growing food for ourselves that maybe the pesticides and things are like that, because I am so highly sensitive to things. Maybe that will help reduce some of my pains and problems that I have. So, I mean, we are literally trying everything, but nobody's going to do it for you. You have to do it for yourself
Yeah.
and your loved ones, because honestly, there's times where I'm just so exhausted from it. I'm so irritated with the doctors gaslighting me or whatever that I'm just like, screw it. I'm just going to deal with the pain as much as I can. And I've gone through therapies. I've gone through psychological stuff, of just getting over the guilt of, okay, today I'm resting. I just had a migraine 2 days ago. I have gotten to the point where I'm not even fighting it anymore. It's like, okay, it's a day in bed. I'm just gonna have to go with it because I know that if I do that, it only lasts 24 hours, and then the next day I'm fine, and I'm generally fine. So I know I've learned how to take care of myself. Oh, actually, that's one of the things I wanted to do. I wanted to do
What's that?
a personal manual, a caregiving manual for myself
Ah,
of what has worked, what doesn't work. It's a notebook.
that's where the illustration of you on the cover, like the Operation game.
Yes. And I think I have seen some out there, but it's not exactly what I'm picturing. So I need to come up with something like that. And I wonder if anybody else would like something like that. It's interesting. It's like, a manual for your car or an appliance. It's a manual for your own body. And it develops over time.
They removed your vagina bone.
You're still on the operation game? You goofball.
What does that even look like? You have tweezers in the board game and you're like removing the vagina bone?
You are such a visual person. And you know what? I love you.
I love you too.
Laughter is the best medicine, and you always do this.
That's the cure.
Yes. You always make me laugh, and I appreciate you doing that because it stresses me out seeing you worry about me.
Yep.
And I know you go through a lot worrying about me and stuff, and that's why you go to karate.
Yes.
And um just we've learned over the years. We're only 48 years old, and we have gotten an early glimpse in our 20s of how we've had to grow up fast, if you will. And the aging
Yes.
process, we've kind of had to start early.
Thrown to the wolves.
Yes. And so this is why we're sharing some of our stories and we'd like to hear your stories of what you're going through.
That's why we're talking to ourselves in the car.
Yes, we're talking to ourselves with microphones on our faces.
Yes.
And
the show's about to come to a closing because
Yes.
Our exit's coming up.
And the Tesla has been driving this entire time. And how do you feel, honey? You're in the driver's seat.
Going like 82 miles an hour with no hands on the steering wheel, and it's zipping through traffic, passing on the left like the semi trucks. It's a little bit interesting. I still feel very comfortable. I have not moved my hands this whole time.
I am excited to see people in their 70s embracing Teslas, knowing that it's going to keep them more independent longer.
Yes.
Because losing the ability to drive is one of the biggest things we're dealing with right now.
And it's beautiful to see how it's being restored with some videos that we watch and we see people.
Yes. So I would love to hear what you guys think.
Except your dad. We terrified your dad.
He has been an applications engineer, an electric engineer, and he talked about electric cars back in his college days. And so to see him in the car live, I wish I was in the car with you guys. But to see it actually in motion and to see that it scared him was
it's like the steering wheel is turning on its own.
Yeah. But I love the curiosity and the advancements of things. Yes, there's a ton of scary stuff happening in the world right now, but the only way that I know how to cope and embrace this aging process is just stay curious.
And the progress of the things, the advancements of our future.
And learn to protect yourself and do things for yourself because that's the only person that's going to do it.
Yeah.
And I think we'll wrap it up because we got to get off the exit here. And
that's right.
Before I forget again, I keep forgetting to do this, is please like, share, subscribe, leave comments, all that wonderful stuff, because that helps us share our stories and your stories to more people. Thank you very much. And we're going to roll on.
Yes, we are rolling out.
I love you.